So here we have shown the prevalence of tobacco use, especially cigarette, first in the world and then in Saudi Arabia. We also noted from these few slides that the most vulnerable group among the population is actually the young adolescent, and many of the adults will initiate smoking in earlier years and will continue to do so. Next, let's move to the health effect of smoking and tobacco use. First, we'll talk about the smoking effect of smoking on the individual. Then we'll move to the secondhand smoking and environmental tobacco smoke. So if you look at this graph, you will see that harmful effect of tobacco use, and it's actually affect most of the vital organs of the body. It's not only about the lung, it's not only about the brain, but it also affects the other organ system in the body, such as bladder, colon, stomach, esophagus, and vascular systems. Now, the secondhand smoking is also extremely important, because living with a smoker increases the risk of non-smoker to develop lung cancer by about 20 to 30%. And among this group, the female and the children are particularly vulnerable, and half of the death from the secondhand smoking actually takes place among the women. And there is no safe limit of secondhand smoking. This is again to reiterate, there is no safe limit of secondhand smoking. So we have to minimize secondhand smoking by all means. So these graphics illustrate the harmful effect of secondhand smoking, and it also shows that it relates to sudden infant death syndrome, lower respiratory tract illness, reproductive effect on the reproductive health, coronary heart disease, lung cancer, and nasal irritations, among many others. Now, it is important to recognize the benefit of quitting smoking on the individual, and you can see that it starts immediately within the 20 minutes or so. By about 20 minutes, the blood pressure returns to the normal, the pulse rate also becomes normal, body temperature normalizes. Within about 24 hours, the risk of heart attack decreases, and lungs starts to clear toxins and mucus out of the systems. By about 3 days, 72 hours, breathing becomes easier, and bronchial tubes relax, lung function improves, body energy increases. By about 1 to 9 months, coughing and shortness of breath decreases, sinus congestion and fatigue decreases. By about 5 to 10 years, risk of stroke and coronary heart disease decreases to that of a non-smoker. So this is an important message to tell the existing smokers that even if they quit smoking today, after long years of smoking, tobacco use, they still can be benefited from quitting. And the risk of, within the 5 to 10 years, the risk of lung cancer reduces to that about half of the non-smoker. In about 1 year, risk of coronary disease decreased by about 50%. So the benefit starts immediately within 5 to 10 minutes, and the benefit actually continues for about 5 to 10 years.